Okay, it's time to talk about the colon again. Okay, so the colon, if you remember from an earlier slide, is of course very easy to recognize, and there are different parts of the colon that we should be aware of. First, of course, the beginning of the colon is the cecum, and then we have the ascending colon, and we have transverse colon and a descending colon, and then we have the sigmoid colon, and then we come down into the rectum and the anal canal. So these are quite easy to remember, but there are some things that are unique about the large intestine that are different from the small intestine. One of the things that was described in an earlier slide, earlier video, was that there are things that can be recognized. For example, the tenei coli, which are the three bands of longitudinal muscle fibers that run along the top sides and or through the middle, and they're easy to be seen on another slide anyway. Also the haustra, which are the sacculations or pouches of the colon between the tenei. So these are the haustra. And then we should remember the omental appendices, which are small fatty appendices which can be seen on either side of the tenei coli. They just look like little pieces of fat. And of course the large intestine is much bigger than the small intestine. The internal diameter is much bigger. So let's talk a little bit more about the large intestine. First of all, we should think about the ascending colon. It is on the right side of the posterior abdominal wall, and it extends from the cecum to the liver, where it turns at the right colic flexure, and so it turns at the right colic flexure, and which is also called the hepatic flexure. And one thing we must remember about the ascending is that it is secondarily retroperitoneal. And to want to know what that is, you can look back at an earlier slide to know what secondarily retroperitoneal means. Next, let's think about the transverse section. It extends from the hepatic flexure on the right to the splenic flexure on the left, and it is the largest and most mobile section of the colon, and it is attached to the posterior abdominal wall by its mesentery, the transverse mesocolon. Okay, next, the descending part. This is on the left side of the posterior abdominal wall, and it extends from the splenic flexure down to the sigmoid colon, and it is also secondarily retroperitoneal, as is the ascending. And next is the sigmoid section. The sigmoid is the kind of the S-shaped loop of variable length, and this links with the descending colon, and of course with the rectum.
Every tone up that I kill, and then I chill still what is left is what I like. If you don't agree, like, 'cause I ain't got